How does lymphoma disrupt iron absorption, causing anemia? Imagine your body as a busy city where iron is like fuel for making red blood cells that carry oxygen everywhere. When lymphoma, especially non-Hodgkin lymphoma, happens, it can throw the city into chaos, leading to anemia. One way it does this is through a process called anemia of chronic disease, which is common in lymphoma patients. Inflammation caused by the cancer cells and your immune response releases chemicals called cytokines. One of these, interleukin-6, signals the liver to produce a hormone called hepcidin. Elevated hepcidin levels act like a traffic controller, blocking iron from leaving storage sites and preventing it from being absorbed in the gut. This means even if your body has plenty of iron stored, it can't access it for making new red blood cells. The iron gets trapped inside cells like macrophages and the liver, leading to what we call functional iron deficiency. So, your blood may look like it has enough iron, but your body can't use it properly, resulting in anemia. Lymphoma can also invade the bone marrow, which is the factory where red blood cells are made. When cancer cells infiltrate the marrow, they crowd out healthy blood-forming cells, reducing red blood cell production. Plus, the inflammation from lymphoma can lower the levels of erythropoietin, a hormone that signals the marrow to produce red blood cells. When erythropoietin is suppressed, the marrow's response is blunted, further decreasing red blood cell output. This combination makes anemia even worse. Another key factor is that inflammation-driven increases in hepcidin not only block iron releases from storage but also slow down iron absorption from food in the intestines. This means your body is getting less iron from your diet, compounding the problem. Even if your iron stores are adequate, the iron isn't accessible for making healthy red blood cells, leading to a type of anemia called functional iron deficiency. Other factors can also contribute to anemia in lymphoma. Poor nutrition, whether from decreased appetite or malabsorption, can lower iron, vitamin B12, or folate levels. Sometimes, lymphoma causes chronic blood loss, especially if the gastrointestinal tract is involved, though this is less common. Treatments like chemotherapy or radiation can suppress bone marrow activity, making anemia worse. In some cases, red blood cells are destroyed faster than they can be replaced, or an enlarged spleen may sequester red blood cells, both adding to the anemia. In summary, lymphoma causes anemia mainly by creating inflammation that raises hepcidin levels, which blocks iron absorption and traps iron in storage sites. This results in iron being unavailable for red blood cell production, even when iron stores are normal or high. The infiltration of the bone marrow and suppression of red blood cell production also play significant roles. Understanding these mechanisms helps doctors tailor treatments, such as managing inflammation, carefully considering iron therapy, and addressing the underlying lymphoma. Always consult healthcare professionals for personalized advice, as each person's situation can be different.